Hello and welcome. The topic of today's video is how to stop breastfeeding. Before we get started, there's a disclaimer. This slide video is for general information purposes only. The author is not liable for any losses or damages related to actions or failure to act related to the content in this video. If you need specific lactation advice, please consult with your doctor and an IBCLC and or a physician who specializes in breastfeeding and lactation, those that are in your area. Okay, let's get started. Figuring out the best way to stop breastfeeding, the method that's right for you, depends on your situation. There are two types of ways to stop breastfeeding. There's baby-led weaning and mother-led weaning. Baby-led weaning is a gradual process that takes into account your baby's maturity and readiness to wean. In baby-led weaning, you can monitor your baby's feeding pattern and hunger cues without initiating or denying breastfeeding. As your baby grows and starts consuming solid foods on a more regular basis, they may go for longer stretches without nursing. You might also notice them spending less time at feeds and becoming more interested in snacks. Depending on their age, meaning their interest in eating snacks, might be a sign that they might be ready to wean. However, it's unlikely for a baby to self-wean before they are in the 18 to 24-month age range. And it is possible that there are other factors such as distraction and nursing strikes that can occur in babies that may make it seem that way. So if you've noticed there's a difference in feeding pattern and your baby's feeding less and they're under 18 months of age, the cause could be distraction or nursing strikes or even other conditions that you might want to consult with a physician or lactation consultant to know the underlying cause. If your baby is older and seems ready to wean, you can start by consulting with your physician and local lactation consultant, and if okay, reducing feeds one at a time, making sure that when you've dropped one feed, you give your child time to adjust. Mother-led weaning occurs without the cues of your baby. There are multiple reasons for mother-led weaning. Some are due to medical issues and the need to take a medication that is incompatible with breastfeeding. Other reasons can be due to pressure from others, feeling ready, or planning to return to work. Many women don't realize that they can continue to breastfeed even though they plan to return to work. If you're planning to go back to work but want to learn more about how to breastfeed while doing so, there's a great book by Nancy Moorbacher titled Working and Breastfeeding Made Simple. She's an internationally board-certified lactation consultant, and her books offer comprehensive and in-depth breastfeeding information. If you know you want to quit breastfeeding sooner rather than later, there are two ways moms can stop breastfeeding. There's gradual weaning and there's untimely weaning. Gradual weaning involves planning ahead for a gradual transition. Untimely weaning involves emergency weaning, unintentional weaning, and unavoidable weaning. We'll discuss them in the next few slides. However, I've got to note first that if your baby is less than 6 months of age, you should only feed them breast milk or artificial baby milk, also known as formula. You might need to be aware of any allergies to formula though, as some babies can show different reactions to different types. However, you will need to speak with a lactation consultant directly to help you determine what would be best for your situation and your baby. For a directory of internationally board-certified lactation consultants, you can find one in your area through the International Lactation Consultant Association directory at ilca.org. Gradual weaning. With gradual weaning, you can drop the feeding that is least preferred, allowing a few days to pass, at least 2, for your baby and your breasts to adjust. You can substitute a snack or fun activity to replace the missed feedings. That is, if your child is old enough to consume solid foods. In this case, you can also have a breakfast meal ready for when your child awakens, if you want to drop a morning feed. You can also look at alternative ways to help your child fall asleep, or have your partner or a caregiver be in charge of getting them to bed if you'd like to drop a late night feeding. As you and your baby adjust to the reduction of each feeding, you can then eliminate another feeding, gradually continuing in this way for several weeks or a few months, until you're down to breastfeeding every few days, until you reach a point where you are no longer breastfeeding. Untimely weaning. There are instances where you may need to stop breastfeeding sooner rather than later. Immediately stopping breastfeeding can be uncomfortable and painful, but with the right steps and expert support from an IBCLC and physician trained in lactation, you can make the transition less strenuous and potentially avoid any difficult complications such as mastitis. There are three main types of weaning considered untimely weaning, and they are emergency weaning, unintentional weaning, unavoidable weaning, that we discussed in an earlier slide. Emergency weaning. If you have to wean immediately, chances are you are going to experience 24 to 48 hours of unpleasant and painful engorgement that will slowly subside. However, you can get relief from cold cabbage leaves applied to the breasts. This is not advised for those allergic to sulfur or cabbage. Cabbage contains sinigrin-rapine, mustard oil, magnesium, oxalate, and sulfur heterosides. Placing cold cabbage leaves on the breasts and changing them every couple of hours has anecdotally been said to relieve engorgement by many women who have tried it. Placing ice packs wrapped in cloth can also help reduce the pain and swelling associated with engorgement. However, in emergency weaning, do not apply heat in this case, as it can promote milk flow and swelling and possibly lead to mastitis. And do not bind your breasts. Outdated medical texts or older relatives might recommend breast binding, but this can actually increase the risk of plugged milk ducts, leading to mastitis and increased pain. Medications. In emergency weaning, in addition to an IBCLC, you will also need to consult your physician. They might be able to prescribe certain medications that can help reduce your milk supply. Unintentional weaning. There are cases where mothers will actually want to continue breastfeeding, but have started giving increased numbers of supplemental bottles during feeds to a point where their milk production decreases significantly. This can especially be the case during the holidays, as the hectic schedule of such times can lead to greater infant fussiness and increased supplementation, which can make it more difficult to start breastfeeding again or build up a supply. You may not want to continue breastfeeding after this happens, but if you do, it is possible to do so through building your supply back up or through relactation with the guidance of a lactation consultant. Unavoidable weaning. There are situations where you might need to stop breastfeeding due to reasons outside of your own control, such as a serious illness or having to take a medication that can pass through your milk and would be harmful to your baby. If you're unsure of whether or not a medication can be taken while breastfeeding, you need to consult your physician and a lactation consultant. If you have time before you have to receive a specific treatment or medication and would prefer to gradually stop breastfeeding, you might be able to follow the gradual weaning guidelines discussed earlier if you first consult your physician and primary care provider. If you have less time, you will need to discuss the best method to stop breastfeeding with your physician and local IBCLC. Mental and emotional health. Stopping breastfeeding isn't easy for most moms, but finding the right support and resources can greatly help you. There might even be feelings of sadness or mixed emotions when you stop breastfeeding, feelings which are quite common. Your capacity to comfort your child will not decrease when you stop breastfeeding. You can offer just as much care to your little one through the love and attention you provide. If you experience more profound feelings of grief from stopping breastfeeding, you might benefit from seeking counseling or therapy. It is possible that you might need to see your primary care provider to get evaluated for clinical depression in such circumstances. If this happens to you, you're not alone. About 15% to 20% of women experience postpartum depression, and with the right strategies, treatments, and guidance, you can overcome it. Postpartum Support International is also an online resource that offers help for both moms and dads. And I've included a link in the references at the end of the slideshow. However, you might also be totally ready to stop breastfeeding and not feel upset, but rather relieved, and that's okay too. You shouldn't feel mom guilt either way. The decision to stop breastfeeding is not an easy one. Knowing when and how can seem overwhelming. It depends on you, your baby, and your personal circumstances. Having the right support and information can save you a lot of pain and unnecessary problems, so you can focus on what's best for you and your little one. In most cases, stopping breastfeeding requires a gradual process. but if done right, can make the transition easier. So don't hesitate to reach out to the lactation experts and other support networks in your community to get the help you need to stop breastfeeding in the way that works best for you. And that's the end of our slideshow today. I've included a list of references of where you can find more information and also a link to the post on the blog. Okay, have a great day. Take care. Bye-bye.